Hi, Athena. How's it going?
Hello, Anas. I'm doing well.
Happy Easter.
Yeah, it's
So, Athena, I came across your work and the initiative you're doing about Zina. But before we get into that, I would like to know more about you as a physician and your role and what you are doing and what is take you for that community you are building. So we will get more deep. So tell me in a nutshell who you are.
yeah. So I'm a pediatrician. I work in hospitals and urgent care in Seattle and in the surrounding areas. And I have a background in global health work. That is what drove me to go into medicine was my passion around global health work. And my experience with that showed me a lot of the challenges in our own healthcare system. And I wanted to shift our healthcare system functions and the foundation of it by working with other people who also see those challenges and working together toward a shared vision. So that's what drove me to create Zina.
Sounds good. So here the foundation. Everyone in the system, we agree the system is broken and they are not happy in the system, starting from the patient until the CEO of the hospital, and everyone is claiming. But you take this initiative and start to think about your community and make human centric. So can tell me why you step up and take this accountability initiative? Thank you to do that, but why?
Yeah, I just feel a drive towards it. It feels like something that I feel really passionate and excited around. And I think it's because I'm optimistic in a way of what's possible. I know that when humans come together, we have so much possibility of what we can create together. If we work under a shared vision and we share our resources, it's absolutely possible. And it's been shown time and again in different programs out there that work to shift the health of their communities. So there's evidence that it's possible, and we just need to learn from these initiatives and work together to shift our healthcare system. So, yeah.
So, speaking on number and statistic, from your experience, how is the social justice will help improving our healthcare system?
Yeah, that's a great question. I think it's really the foundation of what our healthcare system should be built on is social justice. We need to be really looking out for our communities and caring for the people that are around us. And that helps the health of everyone if our basic needs are met, if we feel like we're safe in our communities and we can share uh, our gifts, then we all get to benefit from that. So, yeah, I think the coming together in that way is so important.
And I believe also you consider apart from what you are doing, also the healthcare front line. As a human, you are taking care about their mindfulness, wellness, and all those stuff. Because most of the time when we discuss about the system, we think about the processes, policy, procedure, workflow, technology, but we came to overlook about how our human resources they are doing. So one of the things you start to think about also to give the support for the front line. And my question here, how is the finding team play a role and trauma informed trained to help those frontline work and achieve their goal and give the patient the high quality? Is there is any match if someone came with the big T or small T in the past and offered services for the patient, or this is doesn't matter? Everyone have his own or on a trauma, and we all will be survived from this.
Yeah, I think we all have some sort of trauma we've all been experienced. Just living in our society can be traumatic in a way because a lot of our systems aren't really built to support everyone. So I think especially people in minorities, especially the Black communities, experience systemic racism, and that in itself is a daily traumatic experience. And our chronic stress and our work environments and all of these things can be, traumatic to us. And people have experienced trauma within the healthcare system itself, whether they're caregivers, watching family members have experiences that are really painful, or themselves having to navigate the system. And so I think there's a lot of challenges that we've all faced. And the important thing as leaders is that we understand that we have all faced these challenges and that people are doing the best that they can, and that our job is to uplift other people and open doors, create opportunities for them to be healthy and to navigate their way to health. And so, yeah, I think as leaders, it's so important to be trauma informed and meet people where they are, understand that we're all doing our best.
And this will lead me for the question maybe more about your specialty because you are pediatricians. And here I'm thinking about the parent when they came and their baby sick or have an issue. And how is the pediatrician take care for the messages, how they send those updates and inform them about their son or their kids what they are struggling for, because this is very sensitive. Especially maybe you can accept it for yourself if you have any big disease, but you will not feel good for any simple things happen with your, even the small injury with your parents. So how you as a doctor and pediatricians overall do you see this is something, the communication and the way it's part from your role to make sure they are taking the information in proper way and not giving them a trauma?
I'm not sure that I totally understand your question. You're saying, how, as a pediatrician, do we communicate with parents?
Yes, especially when we discuss, we need to be trauma informed. So, as a pediatricians and as a doctor who is dealing with the parent, is this is something you consider also to transfer it for the parent, or this is something
Mm,
we know there is a communication breakdown all the
yeah.
level, and the doctor, because for the shortage and limited resources and the time sensitive they have, sometimes they are in rush. So, is this is the same with the kids and with the pediatrician?
Yeah, I work in hospitals and urgent care, and so my world is different from primary care, what they are facing. But I do have some experience in primary care, and oftentimes the system's not really built to take the time to understand the challenges that parents are facing and to provide that education or information about healthy parenting. I know in our history as pediatricians, we used to tell parents to not give their kids much attention, as that would spoil them and make them so it would make them like too clingy or needy. So parents would leave their children aside and not provide that affection. And that was our advice for a while. And as pediatricians and in medicine in general, we're a little bit slow to take on new ideas around how we can educate families. And so they kind of perpetuate for a while. So I'm not sure that pediatricians and people in medicine are really that well equipped to give people that sort of advice. I think our strength in our healthcare system is fixing problems that are immediate. And we have, a great capacity for technology and doing really complex surgeries. So I think as a provider, what our job should be is to open doors for people and say, if you want to join a support group with other parents, or you want to do this class, or whatever it is, we can open the door for them to explore that.
That's very, very powerful answer, and thank you for that. Yeah. So here it's kept to my mind. I know what is the you mentioned what is the your motivate you and main driver to create Zina, but I'm looking to dig more deep about understand the idea from bring this is you witness something gap, it's happened one day and you decided to bring the community, or because you have the experience with the global healthcare system you find a good initiative out there and you think it's good to bring it into the home and start to implement it. So for sure there's many reasons, but what is the reason number one let you to go and create this community?
Yeah. So when I did my global health fellowship, I saw how we were pushing a one size fits all healthcare model on these communities, and we weren't really asking them in any meaningful way what they wanted and what their healthcare system could look like. And I saw the effects of that on the community. And how disempowered they were and disconnected they were from the healthcare institution. And I saw the harm that it caused. So then when I came back to the States, I realized this is something that we do here as well. We have 2/3 of bankruptcy cases are due to medical debt. And so when I was working in Rwanda, I saw people having to sell their land and their animals and stop feeding their children so that they could afford medical care. And so that happens here as well. And here we're also pushing a healthcare system that perhaps doesn't work so well for the communities that we're caring for without really asking what they want and listening. And so I created Zina so that in order to have that collaboration with other people to be able to make those adaptive healthcare models for communities that are listening, not just once, but they listen over time, and they can evolve and change what services are provided and how they're provided to those communities. So yeah, it came from realizing that all of that is happening here as well.
Sounds good. So now you are partnering with the healthcare leaders in around you and also overseas, try to find and make the change. So if I want to ask you, you and your team and those health leader where you try to make a sustainable change and improve and fix what is broken in the system, how you picture Zina in the future? So if you approach your ultimate goal, so what you will do, what you will fix, and what is your priority? I know this is too big a question, but if we want to picture it together and see what is in your mind, can you share this with us?
Yeah, it's actually where I started with Zina. It was this big picture, and Zina is a step, or where we are right now is a step in that direction. And so, what I ultimately see Zina as being is a network where there's resources and support for communities to create the healthcare system that works for them. And so, we'll be creating adaptable healthcare models based on what the community wants. And there could be a standardize certain elements that are in that system, such as ERs, surgeons, and blood banks. Certain things that are in all of them, but the community can choose how many social workers they need, what the access to, like maybe they want to see acupuncturists, they want access to yoga or different things like that. And they may also be a community that has a lot of elderly population and they need more support for the elderly. So yeah, that's where I see Zina going, is these adaptable healthcare models.
It's more into ecosystem. If I am, because I'm trying to ask the questions for the audience, if they watching us, and I know based on the statistic, 30% of my follower they are in C level and senior level. So if someone those level is very high, committed, and they working in different things, they cannot join the community, but maybe they want to support. What kind of support they can offer for you without getting any commitment to be part from this community?
Yeah, if anyone knows other people that would want to join, they can refer them to like my LinkedIn or my website. So just kind of raising the awareness around Zina would be really supportive. And then there's soon, within the next few months, we'll be starting to take donations as towards our pilot project. So right now we're figuring out what our pilot project is going to be, and we'll be launching it at the beginning of next year. So I think just in any expertise, if you wanted to just network, meet with me and see how we can collaborate, work together, if you have a lot of knowledge in fundraising or different areas that you feel could be supportive, that would be amazing.
I think this is something because you mentioned you will start to collect the donation and make the fundraising. This is need a special skill set for this area. And as you and every doctors and every healthcare profession, our information there is limited. Do you have team working with you to make sure they have the good connection and working to bring the money and know exactly how to utilize this money and save you, because it is non-profit organization and you need to make sure all those donation go for the right place?
Well, so it is an LLC, and Zena is going to shift into being a B Corp where it's going to be owned by the mission, but any donations would go toward the nonprofit that we're supporting in our pilot project. And so the people in that nonprofit, they understand how to handle the money. And so we wouldn't actually have much to do with it except to raise awareness around the project that we're doing and how much funds we need and for what. So yeah.
So if I understand you, LLC, that means you will have profit area to work with that and non-profit. So all donation you will take it and allocate it for non-profit projects, correct?
Yes. So those donations will go. And then once it's a B Corp, we'll also have people investing in our company. And it's a social enterprise. And so a percentage of the money that from our profits from membership and things like that will go back into our projects. Yeah.
A lot of the work internally. I will not bother myself, but I'll try to find a way for anyone interesting to make the change and have the future mindset and open mindset. Just connect with Athena. Athena, she is smart and have a lot of the things. Every time I sit with you, I see a lot of the project you put it on the table, and hopefully we will start to see the project. I'm very excited to see the first pilot project you'll bring it for us.
Yeah, I'm really excited about it too. Yeah.
Okay, now I need to read this question.
Sure.
I think there is something it's here duplicated. I will skip them. How does we cover it already with the discussion? Yeah, here you told me still the first project is coming and this is the pilot. But is there is any other maybe initiative, assignment, something social impact you did? You see it very powerful, impactful. You would like to share with us? I know Zina, is this something is new? Still, it's evolving and growing. But till this time, is there is any project you can share or nothing until you start your pilot?
Yeah, I've been trying to get a project off the ground in northern Washington where we'll bring in more community health workers and have them more integrated into the system. Community healthcare workers are people that are trusted members of the community who connect people with resources. So things like transportation and housing, and they also help people navigate the healthcare system. So they serve as bridges from the healthcare institutions and the community. So I see them as really important to addressing people's basic needs. And I think when we get to the root of people's health issues, it's really these social determinants of health and these basic needs, including mental health. These are all really important things that we need to focus more attention and money on, is addressing those. And we'll see so much less chronic disease and other health issues in our communities.
Amazing, amazing. I know you are most advocate and supporting decolonization. So I want to ask you how this look like in the healthcare system and how this will help us to improve the healthcare system and have equitable healthcare system in the future.
Yeah, so I think colonization, it has had an immense effect on our systems. It's really embedded in our systems. I don't think that we can do a lot to our current system to make it healthier because the foundation is really based around profiting off of other people, and specifically like disease when people are sick. And so when we try to make changes within our current system, it comes back to what the root of it is. So I think decolonization looks like building something completely new that really brings in the voices of the people who are impacted by what you're creating and the services that are being provided. So they are equal partners in the development of that system. And that's, I think, what I see as decolonization is empowering people, amplifying their voices so that they feel like they have some say in how their healthcare system looks.
It is very complicated or a very complex idea, and it's not easy to everyone to understand it. However, I believe everyone support what you are talking. No one will against you unless
Yeah.
if I am a very rich
Well,
man.
I could give an example of how it's been done. So in Alaska, they have the Alaska Native healthcare system called the Nuka system of care. So 25 years ago, they had IHS, which is Indian Health Services, and that their communities were struggling with mental illness and substance abuse and lots of chronic diseases such as obesity and diabetes. And they had the opportunity to make their own healthcare system, just not use IHS system anymore and create their own. And so they took it on, and their community members are called customer owners. So the patients are customer owners instead of patients. And so they're part owners in their healthcare system, and they get a say on what services are provided to them. And they've had an incredible impact on the health in their communities just by listening to them and following through on actions that the community is wanting, so that it might look like the healthcare system is helping to demolish or to change a bar where they had, if they had like a bar next to a children's park or playground, they would shift it into a coffee shop because that's what the community wanted. And that's something that the healthcare system helped make happen by partnering with people in the community and working together.
It's
think that's
massive change. So I'm wondering. I'm not expert in the American history, but this is happening in Alaska, and they did this good result because they are somehow it is a special state where it's in the historical come part from, I think, from Russian, or this is because they believe in what they do and they find a way how to make this change. So in a different way, why Alaska did a great job and other states they cannot make that the same job what they did it. So I think other state they will take Alaska a role model and try to change the system. Why they are not doing what Alaska did?
I think part of it is we're just so focused on the problems, but we're not really looking at what's already working and the solutions that are already out there. And so many people don't talk about these sort of programs or healthcare models that are revolutionizing healthcare. Instead, we're trying to fix what we already have and talk about the problems that we have. So I think there's just not a lot of awareness and hype around it.
Yeah, and this is will take me for the questions now. Let's dig deep on the system in the hospital on any healthcare system. How having a value and mission with the organization will help the leader of that system or the hospital or clinic, whatever, to be aligned with his team or her team to work in toward the same mission.
Yeah, I think a vision and mission is so important. It helps everyone to go in that direction instead of scattering their energy and investments in different directions. We're all moving in one general direction. And it's something that, people that are part of that organization feel aligned with. And that's why they're in that organization. So I think, yeah, and that's a big part of being a leader within that system is holding up that vision, making sure that we're going in that direction. And a lot of times, what happens instead is we have the vision and mission written on a wall or on the website, but nobody really talks about it. It's not part of the culture. And so I think it's so important to really embed it within the culture and make sure that we keep realigning with that direction.
Amazing. So I don't want to bother you with this question, but I would like to ask you.
Okay.
The question here is, can we have that saying most of the time? Doctor, they are good in what they are doing as treating the patient and diagnose the patient, but they are very bad when it's coming for management and leadership. So there is the, let's say, initiative or start having that request. Our leadership in the hospital, they are not equipped and qualified to be a leader. They are good in medicine. So better for us to bring someone from outside have this leadership. For me, I have my own observation that sometimes it's very hard to bring someone out of the system and put it, but sometimes it does. So with those two options, bring someone out of the system because they have the leadership skills, or qualified our team with the leadership skills to own the system. What do you think is the most efficient approach to have?
I think training our healthcare leaders, and by leaders, I mean anyone within the healthcare system is a leader. You're impacting the people around you. So a nurse or social worker can be a leader, but training everyone on leadership skills and emotional intelligence, it's not something that we receive in our training at all. And so it's no wonder that we're not great at leading. But a lot of the leadership that does happen is the top down approach of like giving orders, and everyone now has to follow those orders. And it doesn't allow for other leaders to step up and to have a voice about what they're seeing and what they feel like could be different. So I think it's really important to bring everyone's leadership skills to the forefront so we can have people that are closer to the problem helping to shift things and to make things better.
Thank you to bring this on the table. So yes, I had the same experience when I worked on the ICU as a registered nurse. The order is from up to down. It's like you are working in the army. There is no debate at all. And every time I'm asking anyone bring this information or discussion. So I want to ask you why this happened. Why we as a high profile educated people we don't accept any criticism and we believe we are not perfect and we believe we complete each other, but when it's coming to the order, don't discuss with me, take it as is. From your perspective, why?
Yeah, I think it's part of our training and our culture. So we are just responding to how we've been trained to not I mean, as physicians, we're trained to be the experts and to be on a pedestal of not doing anything wrong or making any mistakes. It creates a lot of pressure, and there's a lot of disconnection between the physician and the people around them often. And yeah, I think that it's important to yeah, I lost my train of thought on that one.
Yeah, yeah, it is you don't lose that because it is very complicated. And here, I believe you are doing in this, you are supporting the role of mentorship to prepare the next generation. So if we believe our education system is have his own issue and our healthcare system have its own issue, how to make sure the mentor who will observe and make sure his or her mentee they are taking the knowledge and the skills for the next generation, they are educated and help them in the right way. So from your perspective, and this is part of from your community to call out for all mentors to support the new generation, how we can make sure this is a step will help the next generation.
Yeah, I think as mentors, part of your role is to be advocates. And so, really advocating for more of that training. I think training and culture shift is what's really going to shift how people show up as leaders. And so, I think as a mentor, you need to be advocating for the people that you're mentoring to get the sort of training, or you can open doors for them or offer some opportunities or networking. It's really that collaboration and networking piece that's so important, because there is a lot out there now that people are developing to help people to show up in a more proactive and have those strong leadership skills that are very different from what we've been trained traditionally.
So with this on the table, and we believe on the role of mentorship, mentor's role. So all of us, we agree working in the hospital is very hectic and very hard. It's not an easy. And now everyone start to speak up about the burnout and their experience. And now I remind myself when I start to take open heart surgery for pediatric, and the compassion fatigue, it's way harder than anyone else as an adult. So you, as a pediatrician, and work all the time with the pediatric and with the kids, and you as a human also will be burned out, and in the same time you are thinking for the in the future. So my question for you: how you try to manage your own struggling and burnout, and be consistent with the frontline working with your team also?
Yeah, I actually did experience burnout about 4 or 5 years ago. I'd say like 5 years ago. I was working a lot and I didn't feel like I was had a voice. I felt like I was just a cog in a wheel, and I also was experiencing or understanding a lot of the dysfunction in our system. And so that was a big like catalyst for me to create Zina, was to have feel like I have more purpose in my job, and like I'm moving in a direction that feels more aligned with who I am. So I'm still working as a pediatrician in a system that oftentimes doesn't feel aligned, while also looking towards something new. And I think that's what sustains me, as well as the connections that I have with the patients and their families. And when I do feel like I have an impact to help them with their navigating and help them to be healthier. Yeah.
So when you had that experience 4 or 5 years ago, how you overcome this experience? Did you have it by your own self to overcome, or the system help you to overcome this challenge and to see the bright future?
Yeah, it was really up to me. I did tell the people, hospital that I was working with, that I needed to cut back on my hours, and told them what I was experiencing. And they were gracious about it. And I just worked a little bit less during that time. And that's when I started thinking about Zena and creating it. And so I actually have had more of that schedule since then. So I'm working still full time, but not, yeah, somewhere in between part-time and full-time. And so I had to advocate for that. But I'm in an organization right now with urgent care who actually offers burnout support. So they have a mental health for system within their organization just for the employees. So I think that's really great to be able to reach out to them. I haven't done it myself, so I don't know how good the quality is, but that wasn't existing when I went through what I did.
Yeah, and this is very tricky because we left out our resource to solve their own problem. and at the same time we need them to fix other problem where they are not on the mood to do that. So there is a lot of things we need to consider about that, and I believe you consider this in the community. But overall, as a healthcare system, we need to see our resource as a human resource. They are a human, and we need to take care for them, because if we not, this is will be threat for our patient, and maybe there is increase on medical errors and patient safety incident in the future. Do you agree with me in this concept?
Yeah, there's absolutely downstream effects if you're treating your everyone in your organization as objects instead of humans and as dispensable. That makes it really hard to sustain the workforce. They don't feel like they really matter, or they don't feel like they're being heard when they're struggling. So yeah, I think shifting towards seeing everyone, I mean, definitely the employees as well as the patients as humans instead of objects.
So when we start our podcast, we started to mention you have a global healthcare system experience, and we were in Uganda. And when you're back for home, this is where you see the same things where it's happening there, especially when financial is there. So any good story you found it out there anywhere, and you want to bring it back home, a good initiative, a good system, a good technology, and you are now fighting to bring it to home.
I would say the community health workers in low resource settings, community health workers are utilized a lot to be that bridge. And they're so vital in those areas as well as here, I feel like. So that's an initiative that I think we can absolutely learn from in those areas.
Can you elaborate more about this community health record? What that mean? How it look like?
Yeah, so it's somebody in the community that's a trusted person that acts as a bridge from the healthcare institution to the community. And so they'll advocate for patients to be able to access certain resources, and they'll make opportunities available for people so that they can get their basic needs met,
Mm.
as well as navigate the healthcare system. And if, a community health worker might call you up to check in on you and you say, I'm struggling. I'm having some mental health issues, and they may connect you with somebody who comes and visits you at your home, or they may connect you with a counselor or whatever it is that you feel you might need.
Now, from your experience and from your specialty, what is the unique challenge pediatric specialty or pediatrician they have the other they don't have? Is there is any challenge the pediatrician they have we are not aware about it and you want to speak about it?
I would say there's a lot of fear around children. We don't want to do drug trials on them or test different things for kids or babies, and so there's a big gap of research and knowledge for around children because we have this fear. And I think it's a big part of our systems is that fear. We come from avoiding risk. And so that creates all these gaps where we're too limited in our scope and too limited in our actions.
So we speak why it's in the healthcare system, the order came from up to down, and this is based how we trained. So if we want right now to think about how to inspire new leaders to be engaged with the system and try to find a way to play a vital role to improve the system and see the real problem, okay, and find another experience from our side or maybe from the different state, whatever. So what do you think is good to do or will inspire them to be play that part?
To be great as leaders, like to
Yes, as a good leader, what is can with all respect for our leader right now, we believe there's a room for improvement. So what things we can do to inspire them to become leader like you? Take initiative, try to build your community and do your own stuff. However, you're maybe not as a in the decision maker, but you do that. Imagine you are a decision maker and take this responsibility. You will make a huge change.
Yeah, I think listening to people, understanding what their motivation is and what their skills are and where their passions lie, and helping them to shift towards their strengths, I think. And so that's uplifting them so that they can shine as the leaders that they are. The way that we currently create leaders is by saying, you've been in the organization 5 years, now you get to move up. And do you really want to be in that role? Like you never really asked for it maybe, or it may not really fit your skill sets. I think that's can create a lot of pressure around doing something that maybe you're not really have a lot of strengths around. So I think instead we can see the people around us and see what their gifts are and help them to amplify those and invest in the skills that they already have.
Wonderful. So if we imagine tomorrow you will have the whole power and any power you need to make the change in the system, and you are the decision maker, what the immediate quick things you will do on the system?
If I could just change anything in the system.
Yes, yeah, just tomorrow.
Yeah, just overnight. Yeah, I would say having our communities and patients as part owners in the healthcare system would totally revolutionize how we do healthcare. So, yeah, just letting them have a say in what their healthcare system looks like. I think just doing that overnight
Yeah.
would really change everything.
Yeah, I hope so. Thank you for your time, Athena, and you will bring a lot of valuable insight for us. And what you are doing is very great. And keep going of what you are doing. And I'm looking forward to see your community grow more and more. And in the podcast, we will put your community link if they want to join and your contact information. So having said that, how you would like to finish our episode for today?
Yeah, thank you for this discussion, Anas. It's been really great. And anybody out there who wants to be part of the change, please hop in and join us in Zina. I think we are all ready for it, but whether or not you have the passion and energy and capacity around it, that's the question you should ask yourself. If you're all in, then
in all
join.
cases, if anyone interested, even maybe if not sure it is the right move or not, connect with Athena. Athena, she is amazing. You can discuss or find a way how you can work together. But I hope to find more and more like Athena in our world. You work for the purpose, and this is not compliment. This is really what you are doing. And best of luck in your community and in your career.
Thank you so much, Anas.
Thank you. Bye-bye.
Bye-bye.
If this episode sparked something in you, here's how you can keep our mission alive. Subscribe to Uncharted Narratives Surdiyat. Leave us a 5-star review. It helps more amazing people discover our stories. Share an episode that moved you with a colleague or friend. Connect with me on LinkedIn and join our healthcare innovation community. Together, we're not just telling stories. Until next time, stay curious, stay passionate, and keep pushing the boundaries of what's possible in healthcare. See you in the next episode of Uncharted Narratives Surdiyat.